Small world. Yeah.
Thank you, Christine.
Oh, wow, okay.
All right, good evening, everybody. Thank you so much for coming to our June Rite Night. It's good to see so many smiling faces, and hopefully you got enough pizza. So we have a great speaker tonight. This is Paige Brosidiacono. Did I say it right?
Yes.
So Paige is one of our editors, and she's also one of our graphic designers as well. She does a lot of great work for us. She works at a climate nonprofit in the area, and been here, you said, around 3 years in this area? Okay, very cool. And she's going to tell us a little bit more about specifically this talk and why the topic is so important to her, why she wanted to speak to us about this tonight. So we'll have the talk, and then there will be some time for discussion. We'll wrap up with a few announcements and just a kind of a few quick words about what the Snickle is, if this is your first time here, how you can get involved if you want to be a writer and editor, or if you want to donate and support us. We'll come back and say a little bit more of that stuff at the end. But for now, I'll give Paige a warm welcome and turn it over to her.
Thanks.
I'll leave you with the slides.
Okay.
Yeah.
Awesome. So, yes, hello. My name is Paige Brosidiacono, and I care very deeply about two main issues in the world, and one of those things is climate change. I work at a climate nonprofit. I think that climate change is one of the most important issues we're facing as a world. But the other thing that I care deeply about is abortion, because abortion kills a surprising number of people. I'm going to get into that more later in the talk, but I have always been interested in trying to figure out what is the most effective thing that I personally can be doing to reduce the amount of abortions that are taking place. And that's what kind of brought me to this question. Along with, in the previous edition of the Snickle, I submitted a letter to my pro-choice friend, kind of trying to articulate the thorniness of this issue and the way that people are talking past each other on abortion. But when I was approaching this question of what's the most effective way to reduce abortion, one of the things that I was thinking about is this philosophy called effective altruism, which is trying to look at what is the most effective way that you can use your money philanthropically, what is the highest leverage way to create change in the world with a given dollar. And this organization, GiveWell, did this analysis in 2024, looking at what is the cheapest way to save a life in the world. And apparently, if you spend $4,500 on malaria prevention stuff like nets, very simple nets for beds so the mosquitoes can't get in and bite people while they're sleeping, that can actually save a life. I was very surprised to find out, however, that for just $3,000, apparently you can save a life that was going to be lost to abortion. Me and my husband came across this organization called Save Unborn Life, where the model is they pay women $3,000 to not get an abortion. Women who don't want to have an abortion, but for financial reasons they feel like they have to. And so that really caught my attention and got me thinking okay, what else? What's effective? What's not effective? And that's kind of the core question of my talk is what are the most effective ways to reduce abortions? And there's a couple of sub-questions that I teased out from that. So first of all, I wanted to look into how effective are abortion restrictions. I feel like that's kind of one of the primary levers that the pro-life movement is using, at least in the U.S. and globally to some extent. Stepping back a little bit, I wanted to look at why are women getting abortions? What are the reasons? What are the motivations? What are the needs that aren't being met? And are there ways to meet those needs through changes to policy or through community organizations like crisis pregnancy centers? Is there a way to reduce abortion through that avenue? Thinking about also why don't women choose adoption? What are the reasons there? What's preventing women from making that choice if they're considering an abortion? And then taking a step even further back, how can we reduce the number of unintended pregnancies so that women aren't put in the circumstance where they have to choose an abortion in the first place? So, first of all, some disclaimers. I am not the expert here. I work in climate. I have a background in material science. I don't study this for my PhD or anything. I don't have a PhD. This could be a whole thesis topic. This could be like an entirety of somebody's career. My research has not been exhaustive. It is very possible I've misinterpreted studies, and if you have other sources that you want to bring into conversation with this, consider this a starting point, and I want to have this be the start of a conversation. Second, one thing that I really noticed about the data that I was working with and the studies was that the data in the research is often very much through a pro-choice lens. This doesn't mean that the data is wrong or that people are fabricating the data or anything like that, but just when you're engaging with data, especially qualitative data, like talking about motivations or something like that, there's biases that go into the way you formulate the questions you're asking, the way that you analyze the data, and that can come through in the way that the studies are presented, the way that the data is presented. There's just biases baked into all of it, and most of these studies are coming through a pro-choice lens because that is the primary attitude of the researchers who are interested in studying this. And that's not to say that there isn't pro-life oriented work, but most of it is more through a pro-choice lens. The third thing is this data is very, very messy. It is very hard to get good data on abortion in places where abortion is illegal, and some methodologies are better for that than others. There's some data gaps. During COVID, it was very hard to get data, and so there's some years we just don't know how many abortions there were in different places because of COVID. There's also any sort of more qualitative or people-oriented science. Sometimes you get studies saying one thing and studies saying another thing, and they just have slightly different methodologies, and it's really hard to disentangle okay, what was the better methodology? And you really do need to be an expert in the area to be able to go into conversation with these sources and understand, and I'm not at that level. So with those disclaimers, here we go. So I'm sorry for all of you who can't see this, but this is a chart of what do people die from? Causes of death globally in 2019. So 33% died from heart diseases. That's 18.5 million deaths, 18% from cancer, 10 million deaths, so on and so forth. A total of 55 million deaths in 2019. This is the number of people that died from abortion. 73 million people. It's actually more than all other causes of death combined, and it's just not accounted for because those people weren't born yet. So it's actually, it was astonishing to me to put this in context, put this next to, in scale, next to the total causes of other death, because this is a really huge problem that we're talking about, and even tiny decreases in the rate of abortion can have really big impacts in terms of the number of lives that are saved. Now, I want to talk a little bit about abortion restrictions. As you are all probably very aware, there was a Supreme Court ruling recently in 2022, Dobbs versus Jackson, that removed the protection for abortion in the United States. As a result, we've had a patchwork of different abortion regulations. Some states enshrining abortion as a protected right, some states almost completely outlawing abortion. And a couple of things have happened that have been interesting in the aftermath of that. And it's not all exactly clear what's going on. So first of all, you can see the data. So this is abortion rate over time, estimated number of abortions provided in the United States went down, has peaked in 80s, 90s, went down, hit the bottom, the lowest point in 2017, and then started increasing again. And then there's a jump and a gap in data between 2020 and 2023. And the Dobbs decision was in 2022. So it's interesting, the amount of abortions has actually increased since the Dobbs decision. There's a couple of things going into that. One, women are traveling from states with little abortion access to states with more abortion access. States without total bans experienced a 26% increase in abortions provided in 2023. There's also been increased telehealth abortion drug prescriptions. So the FDA during COVID lifted restrictions on the prescription of like medications that cause abortions to women who wanted to access them. And so that allowance has continued. And so women in states that outlaw abortion have been able to access abortion drugs. But above all, I want to highlight the data is very messy here. There's challenges interpreted in this data. The amount of abortions goes up, but that trend was already starting in 2017. And so there's a question of how much is that a trend that was already kind of baked in that's like has another cause versus actually related to the Dobbs decision. So, but it's too early to assign a causality, but it doesn't seem like the Dobbs decision has really decreased abortions. It seems like the rate of increase from 2020 to 2023 was slightly higher than the rate of increase between 2017 and 2020. So zooming out to global scale now, globally, abortion restrictions have had a mixed effect. So this is looking at every country. This is one of the biggest abortion studies that's been done. You can see this section over here is rate of unintended pregnancy by income group. This section is rate of abortion by income group. And so for high income countries, the red is abortion broadly available, the blue is abortion restricted. And you can see that for high and low income countries, for countries where abortion is restricted, the abortion rate is actually much higher than in countries where the abortion is broadly available for high and low income countries. The relationship is the opposite for middle income countries. You've got where the abortion is broadly available, the abortion rates are higher, which is what you might expect. So it's a little unexpected that the high income and the low income countries, like restricting abortion actually increases the rate of abortion. But there's a couple of things going into that. And part of that is the way that abortion rate is defined. So you define abortion rate as the rate of abortions per 1,000 women, not per 1,000 pregnant women. So this depends on the number of unintended pregnancies that are happening. So when the number of unintended pregnancies decreases, the abortion rate also goes down. And now if you look over here at the unintended pregnancy chart, high income countries have much lower unintended pregnancy rates than low income countries. There's like roughly a relationship there. High income countries, low unintended pregnancy rate. And you also notice a difference between countries with abortion restrictions and countries without abortion restrictions. There's a correlation there that if you have more abortion restrictions, you're also more likely to have a higher rate of unintended pregnancies. And we have to make some hypotheses here about what might be going on. But it could be that abortion restrictions are correlated with decreased contraception access. And so that results in more unplanned pregnancies, a higher abortion rate, but a lower percentage of pregnancies that are ending in abortion. Sorry, that was a lot of data. Feel free to ask questions if that doesn't make sense, and we can loop back to that. So Now let's talk about another thing that is a common tactic used in like crisis pregnancy centers for trying to reduce abortions, and that is ultrasounds. So a woman comes into a crisis pregnancy center, they are, considering abortion. The crisis pregnancy center gives them an ultrasound, they see the baby, and the idea is that seeing that baby helps them develop an emotional connection to the baby and choose against abortion. However, looking at the data for this, there's actually fairly minor decreases in overall abortion rate from this practice. 99% of women who didn't view an ultrasound aborted, and 98.4% of women who did aborted. There is a small but statistically significant effect for women with medium or low decision certainty. So if people are already on the fence about abortion, about having an abortion, then seeing the ultrasound can be the catalyst that tips them over. So it is possible that seeing that ultrasound can get somebody to choose to not have an abortion, but they have to already be in a medium to low decision certainty area before going into that. And that's about 7.4% of the women are in that group. Most of the women are high decision certainty that they want an abortion. And also, the caveat applies with this. This study is done very much through a pro-choice lens, with the motivation of debunking what's going on with crisis pregnancy centers. There's a lot of antagonism in the academic community towards crisis pregnancy centers. So I want to add that caveat there. This is there's definitely biases incorporated into this, but this is what this study came up with.
I think that's interesting though, right? Because it's still 98.5%, so it's still percent lower.
Yeah, exactly. It's not, they didn't fabricate the data. It's just the way that they're asking the questions could introduce some.
So maybe it's actually, who knows, right? Who knows what
Yeah,
there is.
exactly, yeah. So second question, why do women get abortions? So this is looking specifically at abortions in the US, a study from 2013. And this was a fairly large sample size. I think it was about 800 women. And they were able to mark multiple choices for what was motivating them to get an abortion. And they grouped them into a couple of different categories. So 40% of women attributed financial reasons for why they wanted to get an abortion as one of the things. Only 6% of them picked only financial reasons though. There was a lot of other things that went into that as well. So with finances, some of the quotes that came up with women: financial problems, don't have the means, it all boils down to money, can't afford to support a child. People are also worried about bad timing. 36% of women cited that as a reason. So many things going on now, I'm physically, emotionally, financially, pretty busy, can't handle anything more right now. I'm too old to have a child, it's like starting over, my nerves are bad, my son, he's gonna be 20 next month, I don't wanna start over. 31% of women, it's partner related. They don't have a good or stable relationship with the baby's father. They want to be married first. They're with the wrong guy. Partner that doesn't want the baby, or even an abusive partner. And 29% cited the need to focus on their other children. So this is women who already have children, and are trying to think about planning their next children and maybe don't want any more children, or feel like they want to wait longer before they have their next child. So there's more reasons beyond this. Fetal health came up, maternal health came up. Each of those was only about 5-ish% of people. It's mainly these are some of the bigger reasons, and the health concerns are actually much lower down on the list.
And not to get too into the weeds, but they could select multiple things.
What?
They could select multiple reasons.
Yes.
So it's by just 90%. Okay.
Yeah. So this doesn't add up to 100. It's 40% of them picked financial, but only 6% picked only financial.
So it's not like they were stuck between two choices, like which one is bigger.
Yeah.
It was all factors.
You check all of the things that apply. Yeah.
Based on what you've learned and read, do you feel like there is another, like, does this actually cover like all the reasons why people would have abortion?
This isn't.
Or like that might not be shown here that you think could have been asked or should have been asked, or that just were not reported?
Yeah. So this is just the top 4. There was actually more that were on the list. Some of the other things were like, it would be disruptive to my life plans, the health stuff. I just don't want a child. With this kind of stuff, it's a little, it's a little bit hard to be exhaustive in like all of the reasons that you can give. But yeah, there were other reasons that people gave. It was mainly like, it mainly boiled down to like a lot of the things I think actually did fall under bad timing. That's like people just didn't feel ready. One of the reasons was like I'm too young, or like I would be embarrassed to have a child. Like people would judge me. My family isn't supportive. Like that kind of stuff. So I guess, a question I had coming out of that, finances was a big reason why women are choosing abortions. Can we potentially address their financial needs? And that's kind of like the thesis for Save Unborn Life, and the reason I started looking into this in the first place. So Save Unborn Life has prevented 138 abortions for $3,000 each. The women visiting the crisis pregnancy centers, they don't know about this opportunity ahead of time. This is like a thing that's only offered to them if they express that they don't want to have an abortion, but the financial reasons are preventing it. That payment is distributed after birth, so that they have to actually follow through and have the kid in order to get that money. The question is like how scalable is this strategy? Like what's sort of the opportunity space for like the number of women who would take a deal like that? Another study found that 60% of women who had abortions said they would have preferred to carry to term if they had received more emotional support and financial security. It's not just finances, it's also that emotional piece as well. And you could see that going back here, the partner related stuff, people want to feel like they have support, like that it's not just going to be them taking care of this child. And like I said, it's not just finances. Only 6% of the women in the previous study gave finances the only reason for ending their pregnancy. So it's very complicated. It's unclear if this, how scalable this strategy could be, but it is something that is anecdotally working. The question is like, nobody in academia is going to study like Save Unborn Life and the effectiveness that they're having, because that doesn't line up with the kinds of things that there's typically doing studies on. And but maybe depends on how you frame it.
In the whatever data they have for within Save Unborn Life, did they have the information of whether or not the women who chose to give birth, what they chose to do with the children afterwards, whether they chose to keep them or give them for adoption?
That's a great question. I reached out to them to ask, and they haven't gotten back to me yet. Do you know, Michael?
Anecdotally, almost all of them, but very few give them for adoption.
Yeah.
Which they were surprised by.
Okay.
That's true in general. I would expect to say.
Yeah, that's actually something I'm going to talk about in just a moment, the adoption piece. So yeah, I guess big question, how much impact can cash payments have in reducing abortion rates? That's a research question. If anybody else wants to go out and like study that.
It's the same question as what Hungary tried, right? Like they're trying to give, parents, couples, like money to have children, right? And you get the first
Yeah.
one, and that hasn't worked. It's much more than financial.
Well, like I guess it's a little bit of a different question, because it's like trying to induce somebody to get pregnant versus trying to keep somebody pregnant once they've gotten like an unplanned pregnancy that they don't want.
Sure.
So, yeah, but they're related questions.
Like to have a child and raise it, right?
Yeah. And like another thing that I started looking into, but it didn't make it into the slides, is looking at like guaranteed income pilots for women who are like low income and having kids. There's like a program in New York City where they pay women who are part of it. I think it's like $1,000 a month, and it's like, you know, just for over the course of the first 3 years of the child's life. And that's been shown to have great impacts on like health and getting the kids out of poverty. But it's unclear, you know, they haven't looked at like if that program makes the difference between a person considering abortion or not considering abortion. So wasn't very conclusive there, but that's kind of another angle of this. So yeah, thank you for asking about adoption. That's a question I had too, is like, what's happening to these children after? And also for the reasons that women give that are not financial, like that are support related, that are not solvable with like handing them some money, is it solvable by just them giving away the baby? Can they give the baby up for adoption? This is a very understudied topic. I had a very hard time finding sources for this, but and also like the bias showed up really strongly here. A lot of the studies are like biased towards proving that abortion is a better alternative than adoption, and rather than like diagnosing how to make adoption a better alternative. They're not trying to improve it. They're trying to like debunk that like it's an option besides abortion. So the first study I looked at, adoption decision-making among women seeking abortion, basically few women, for women who were denied abortions, they like went to go get an abortion and they were like too late, like too far along gestationally to get the abortion. When they were denied that abortion, 91% of the women who went on to give birth kept the children. They did not, only 9% gave them up for adoption. So it seems like the decision that people are making is not like abortion or adoption, it's more abortion or having the kid and parenting the kid. And that was a really like surprising study result to me. I was looking at another study called Choosing Life, Birth Mothers on Adoption, Abortion, and Reproductive Choice. So this is looking at women who did decide to give their baby up for adoption. What was kind of their thought process? And one thing that stood out for me from that one is that those who chose adoption chose it instead of parenting, not instead of abortion. So they weren't even considering abortion. They were considering, do I keep this child or do I give it up for adoption? So there's like kind of different thought processes going on here. And then I looked at another study called Adoption is Just Not For Me, how abortion patients in Michigan and New Mexico factor adoption into their pregnancy outcome decisions. And they interviewed 29 women who talked about their reasons against adoption. These were women who decided to abort their children. And three main themes emerged. One, continuing the pregnancy and giving birth was inseparable from the decision to parent. That like they felt like after going through all of everything with the baby and feeling the baby kick and giving birth, and just like that they would develop an emotional connection that is not breakable, that it would feel bad for them to give that child up, that it was their child, but if they got to the point where they gave birth. Second thing is choosing adoption would represent an irresponsible abnegation of parental duty. So this is saying that like I made this child, if I'm responsible for this child. It's like irresponsible for me to pawn this child off to another family, or it's irresponsible of me to put this person into a situation where this like child into a situation where they won't know their birth mother, they'll feel unwanted. There's like that kind of guilt that's associated with that. And that's related to the third reason, adoption could put their child's safety and well-being at risk. That they're worried that maybe the baby's going to get given to a family that's crazy or something like that, that they'll like abuse them, or that they'll have like a really hard life as a result of being adopted. So it was a really interesting look at that. And I don't have an answer to this, but the question that emerges for me is, how do we make adoption a more attractive option? You know, like, are there, yeah?
I just had a question, or a comment, I guess, about like all of those like stated like reasons why not adoption.
Yeah.
And to me, they all sound like they are already parents.
They do.
Right?
Yeah.
They
And
do.
that's something that I think maybe could be like a way to make adoption is telling people like you're already a parent once you're pregnant.
Yeah.
And it's something that comes up even in my workplace, like, oh, like we're not like part of the parent like group yet because we're still just pregnant. Like, no, you're already making decisions for your baby while you're in the womb. You don't drink, hopefully. You don't smoke. Like, you've already changed parts of your life in order to be a better parent.
Yeah, totally. And that was coming up for me too, is like, it's like these reasons, when I weigh those reasons against killing a child, like these seem like stupid reasons. And I don't want to tell a woman like your reasons for not wanting to give your child up for adoption are stupid. Not at all. But the scale just doesn't compute.
Right?
Yeah, but you have to have that perspective that like the baby is a baby and like a human, and that's a life you're ending. And if the woman doesn't share that perspective, I don't see how you can make that argument very effectively.
Well, I guess my dad raised a lot of research on this kind of thing. But yeah, I mean, I'm not sure there's any way. I mean, I think you have to look at the. He's written some on this. Like, once you accept responsibility for the child, you are going to almost certainly going to want to. You're accepting responsibility for the child.
Yeah.
And I think it's very hard to. Like the advantage of abortion is that it's a way to avoid responsibility. It's a way to avoid acknowledging your parent. Once you acknowledge that, then all these other considerations come into play. And I think also just the parental bond is very strong. So I think there's lots of cases where people actually agree to give up their child for adoption. And once the child is born, that happens a lot, right? And there's even a lot of the commercial surrogacy now, right? This is constantly litigated, where even surrogate mothers who are genetically related to the child, once they give birth to the child, they don't want to give it away, and they have those really nasty little, it's a really nasty thing. But it also just makes sense. I mean, I know someone who gave up a number of her kids for adoption, but she was like a heroin addict. But it's like she still thought about them all the time. It's not like you're accepting their responsibility, and there isn't. I don't think there's a way you can try to present adoption as if it were a responsibility-free option, but I don't know. It's a hard. I don't know. I think once you get to the I think that's one of my father's sort of legal arguments. That doesn't make sense to present adoption as a solution to that problem, depending how you conceive of it. It's never going to be that solution. It's never going to be the responsibility-free option. Maybe it's a less responsible option. I don't know.
Yeah, that's a really good point. Did you?
Yeah, I do find it very encouraging, and this goes back to, and I heard you say like they're not as effective as we might think, to do the ultrasound method, but it's like once these women are seeing that there's a life, they want to support it, which is encouraging to hear. Like, they don't want to just put it up for adoption. They want to raise it as their own. Or am I hearing that wrong? I think I'm hearing you correct.
Yeah, that's a good point.
Is there a study on that?
I don't know. So I'd have to dig deeper on the ultrasound study. Because, logically it does make sense that if women are seeing the child and like realizing the life, but I think at least in that study, it just didn't, I guess, yeah, it's a question, in that study it was a question of like, if it had an effect, but only if they were already kind of uncertain. But I think it's still, yeah, it's not.
And I think I'm tying things together that weren't tied together. So
Yeah.
that might not, there was not a straight answer. Might need some more research.
Yeah, it's definitely a need for more research in this space. It's and more research from a pro-life perspective. Yeah.
Yeah, okay. I would imagine, and I mean, I don't have the data on this, so this is maybe just spitballing, but so much of the rhetoric around abortion and around, the prenatal stage of human development, like so much of the social discussion around it pertains to like, when does, life begin, and it's so scattered and people hear so many opinions of, oh, it's moving and it has a heartbeat, but it's not conscious, and, or however they define consciousness, or like capacity for suffering or capacity for brain activity. So I think probably a lot of what could be happening with the ultrasounds of the women who maybe are determined to have an abortion, and the reason why it doesn't change their mind is they're looking at it and they, everyone's pretty much seen like videos of ultrasounds and what they look like. It's kind of hard to avoid it in like media and the internet. So it's not like it's something they haven't seen before, and even though it is their own child, when you combine like the familiarity with it with the combination of like everything that they've been told and probably are either choosing to believe or wanting to believe or trying to convince themselves to believe, is that it's not a baby yet, it's not my baby yet.
Yeah.
So I think that's a very, like, not necessarily the most effective way for people who are already in that mentality.
That's a good point. I wonder also, so going back to the ultrasound study, let me see. I think what was happening here is that like the setting for this was a state where they mandated ultrasounds as like a course of care, like that in order to get an abortion, a woman had to view an ultrasound first. So I don't think these were happening in a crisis pregnancy center. I think that these were happening in like a regular medical setting where like maybe it matters like how the medical practitioners are presenting it. It's like, okay, do the ultrasound and then you can go do your abortion. It's just a clump of cells, versus like in a different setting, they may be like, that's your baby. Yeah. That's already your baby, and it's inside of you, and you were already responsible for it. So I imagine that like I guess sort of the messaging that like accompanies the ultrasound is also can play a big role as well.
I've heard a lot of like that sort of scenario where in states where ultrasounds are required, it's kind of like the most half-baked ultrasound you could possibly get. Yeah. To kind of further that doctor's like agenda. Yeah,
I think that's a possibility.
I'm also wondering when the ultrasounds were conducted, right? Like at how far along into the pregnancy the mother was at the time, right?
I bet that also has a role.
Yeah.
And in what proximity to the abortion itself? Because you hinted this earlier, like maybe by the point when they're doing the ultrasound in relation to when they're doing the study, like most of them might already be settled on getting an abortion. They're not coming to a crisis pregnancy center saying, oh, I really don't want to do this, but I don't see any options.
Yeah.
And there might be a thing too where waiting longer might correlate with being more unsure, right?
Yeah.
Such that, and then like the longer you wait, or it looks like a baby, and then you're like, oh well.
Yeah.
I wonder if the effectiveness. I mean, it's probably going to higher effectiveness the more along the development this is, right? And so, I wonder if that might also play with somehow.
Yeah, it's a good point, because I like when I think like when I first went to the doctor when I was pregnant, like they couldn't even do an ultrasound yet. Like it was just too early. You wouldn't see anything. And so like I think some women know they're pregnant, go in, maybe the ultrasound happens and they're like, I see like a dot and there's nothing there.
Yeah.
It wasn't until like maybe 12 or 13 weeks that you could see some movement.
Right.
But it still was like, yeah.
And that's, I mean, kind of one of the kind of poor arguments on the pro-choice side, or like it doesn't look like a human life, therefore it isn't a human life, right?
Yeah.
And it's like trying to retort that by using that same argument of like, no, it looks like a human life, therefore it is a human life, is like kind of not the right, it doesn't seem like the right way to be arguing, right? It can be, it can have like emotional weight to it, right?
But it's not airtight.
Yeah, it's a tool, but it's not like foolproof necessarily. Yeah, I mean, so much of this comes down to like changing hearts and minds of like, if you believe that it's just a clump of cells, then it's very easy to see why these like reasons for against adoption are very compelling. Like.
Did you? Sorry, you have me because I know there's some data on like not all women who get abortions necessarily think it isn't human life. Like it's not necessarily people have. Like, there's a decent number of people, right? At least in proportion of people who get abortions actually think abortion is wrong, right?
Yes,
like that's where you.
That was actually the study about Reardon et al. The study that found that 60% of women who had abortions said they would have preferred to carry to term if they had more emotional support and financial security. That one looked at like whether people were pro-life or pro-choice. Okay. Unfortunately, the data analysis was not great in that paper, and so they didn't have like for the people who were pro-life, like how. I guess like what, they didn't have like a lot of great like association data.
I think even a lot of people who, in my experience, who are pro-choice actually think it's a child, right?
Yeah.
They don't think we sometimes focus on the philosophical arguments, but I think it's like, I don't know. I think a lot of people do things they think are wrong a lot.
Yeah.
Time in life when they feel like they have good enough reason to, but that's a very different decision-making process than if you're like I feel like my experience is very few people have a particularly developed or intelligent set of philosophical arguments even and it's a very emotional decision. Like, I mean, people are thinking about how much their life is going to change and how their future is going to be derailed from what they planned because of being pregnant, and that's a real struggle. Life does change a lot with the kid. And I would say that I think we're looking at this from a very modern perspective, but in a lot of ways, abortion is a replacement for infanticide, which is very widespread in a lot of different cultures. And most cultures, infanticide is, it's harder to pretend it's not a baby. Everyone knows it's a baby, but people still, people have historically chosen infanticide a lot socially. Because the idea that human life should be the highest moral value is not one that's shared by everyone all the time or cultures. And so I think, even in cases where you have to kill an actual child, obviously people have.
Yeah.
Not usually the mother, but people have done it, and it's.
Yeah, it's a lot easier when you just have to flush a toilet and that's it. It's gone. I'm. Thank you everybody for chiming in. I really have appreciated the discussion on this. Okay, wait, hold on. Let me go back. Okay, so we were talking about adoption. I have like one more topic to go through, and that is how do we reduce the number of unplanned pregnancies? And that brings us to the thorny question of contraception. I'm gonna bring back up this chart that I talked about earlier, looking at like high-income countries versus low-income countries, unplanned pregnancy rates versus abortion rates, and just gonna like really like kind of loop back to how you can see some pretty clear differences in the high income and low income countries between the where abortion is broadly available and where abortion is restricted. And like I said earlier, you have to make some assumptions here, but there's a couple of reasons that could be the case. And one is if people were in high-income countries were having less sex than people in low-income countries, or people in places where abortion was broadly available were having less sex than places where abortion was restricted. That's probably pretty unlikely. The more likely explanation for that is that contraception availability is also correlated with abortion availability. And so in places where there's increased access to contraception, there's lower rates of unintended pregnancy and therefore lower rates of abortion because there's fewer unplanned pregnancies to be aborting. So there's that. There's also a few studies kind of looking at this question of like, does contraception access decrease abortions? The answer is maybe. It's not entirely clear. The data isn't like clear cut, and there's some studies that say like, okay, there's actually a limited effect in these circumstances, but generally you see the most pronounced effects in low and middle income countries. You also see the most effect when contraception is free. Like when studies are looking at like reducing barriers to contraception and making it free. There's also the greatest effect with long-acting reversible contraceptives like IUDs compared to methods with like high potential for user error like pills or condoms. And then also there's some studies that look at this idea of risk compensation, which is like if you know that you have access to contraception or to like something like the morning after pill, or you think you're good and you think you're covered with like whatever contraception you're using, you're more likely to take greater risks or get into habits where you're having sex without like taking the proper precautions or using the contraception in the right way. And so there's some research that looks at that and finds that there's chances for increasing the rate of, like, for teens, for example, having more sex and potentially lapsing in contraception use or like using it properly, that could like increase the rate of pregnancies. But like I said, overall, it does seem that contraception access may decrease abortions, which leads us to a very interesting question for us to consider as Catholics. If contraception use could decrease unplanned pregnancies and therefore reduce the number of people who are killed by abortion, how do we weigh these two sins? Contraception is definitely not licit under Catholicism, and neither is abortion. But for people who don't think that either of those are sins, the question is it morally permissible to encourage contraceptive use as an avenue for reducing abortion rate? And that's a question I don't know the answer to, and wanted to bring it to this group for discussion. And that's the last thing. The takeaways, pro-life strategies like abortion restrictions and ultrasound viewing may not be as effective as we hope, although there's definitely more research needed there. Studies on family planning often don't examine the questions pro-lifers are most interested in, like how we can make adoption more attractive, if cash payments could be effective at reducing abortion, or if another question is like, could NFP be reducing unplanned pregnancies at a broader scale? It's something that hasn't been really tried beyond small communities like the Catholic community. And then finally, like I said, Catholics may need to wrestle with the trade-offs of increasing contraception access to reduce the number of unplanned pregnancies and therefore abortions. But yeah, I would love discussion on this because it's something that like internally I've been wrestling with as I've like gone through this process of researching of like, yeah, how do you weigh these two sins? And that is all I have.